Hey, my name's Dr. Scott Chandler. I'm from Payson, Utah. I've been a dentist for about 13 years. The last 3 years I've become involved in biological dentistry, more the holistic nature of things. I've always been interested in that and kind of always practiced that way. I've never placed a mercury filling in my career and practice. I just always felt like they were wrong, and now with all the things that are out, they're definitely harmful to people, and so that's just been one of my decisions, to take mercury completely out of my practice, and more than that, to protect patients when they have their mercury fillings removed. And so that's something that I've come to learn to enjoy, is to look at the overall health of patients and not just what their teeth look like. And so kind of being more of a mouth physician than just a mouth mechanic that I think a lot of dentists are. I think that's something that sets me apart from a lot of the other dentists around. Amalgam's something that I just never felt comfortable with. In dental school, they teach us that the mercury is bound inside the metals and that they can't get out, and so that it's perfectly safe to have those in the mouth. There are multiple studies out there that you can see the mercury vapors just arising off the teeth, just sitting there in the mouth, and so kind of felt like I was lied to in dental school, and have learned that they definitely are harmful to your health, and in more ways than just the mercury. Just having the metals in your teeth interferes with energy flows through the body and can cause problems with other organs and organ systems in the body. Worry about the overall health. I work with quite a few naturopath physicians and chiropractors in my local area. Patients come from several states around to be treated holistically, more natural ways of doing things, and understanding of the energy flows and the way that the body works and how it's related so strongly to the mouth and the energy pathways that go through the individual teeth. It's something that's just so natural for people to understand, that even those who a lot of my patients don't come to me specifically to see a holistic dentist. They've just been referred by friends or family, and so they don't really know. And so part of the educational process of teaching them why we're different and why we're going to take care of them and look at their overall health is something that we enjoy doing. I have a fantastic team, and they're great teachers, and we love to help these people get better and not just fix a hole in a tooth, for example. You know, all of this whole health is very important, and the oral cavity and the teeth and the gums and all that are incredibly important for the health of the entire patient. Just the energy pathways through the body, there's specific areas and organ systems that are attached to certain teeth, and I came in and saw a new patient and was looking at his x-rays and his photographs, and I could see that he had a lot of problems on certain teeth that are related to prostate, for example. And I turned to him and I said, "So are you having problems with your prostate? Because you know what I'm seeing on your teeth." And the guy just got real big-eyed and was, "Well, yeah, how'd you know that?" And anyway, we see those. I've seen several cancers. We had a stage 4 thyroid cancer in a lady that started working with Dr. Lafferty, and he sent her over to have a tooth treated that was infected, and it didn't look infected on the x-ray, but once we got into it, it certainly was. And as soon as we fixed the tooth and got her restored, her energy flows instantly started working through that tooth, and her thyroid cancer started reversing in a matter of days. And she had a daughter who was in med school who was, you know, trying to keep mom on the traditional medicine pathway as much as possible, and it was a real eye-opener to her to see her mom start to suddenly get better after we fixed a tooth. Now, we're not saying that we cure cancer by fixing teeth. This is the body is a very complex system, but there are a lot of correlations and things that tie together, and being able to understand those mechanisms and understand how the body works on a more natural level, and with the energy flows and things like that. You know, the Chinese have known this stuff for thousands of years. This isn't new information. These have all been duplicated in studies over and over again, proving out these pathways and things. And just seeing these patients start to get better quickly after we do things and fix their teeth or diagnose their sleep apnea and start treating them for the sleep apnea, things like that. It is amazing. For a new patient that's thinking about coming to us, we usually just like to say, give us a chance and you'll be blown away with how you're treated and how you feel, how we educate you. I don't just tell you what you need to do. We show you pictures, we show you x-rays, we go through and educate you to the point that you understand what needs done and why. Why you may be a patient that would need a ceramic implant instead of a metal implant, or why it may be beneficial to you to get your mercury fillings removed carefully and properly so that you're not damaged any by them. Those kind of things, why we don't use fluoride in our practice. That's been a big one. I'm in an area with a lot of small children and families, and I get very few new patients who say, "What, you don't use fluoride? I'm going to go find another dentist." On the other hand, almost all my mothers all say, "Oh, I totally agree. I've been looking for a dentist who won't use fluoride because I've read so much stuff about it that fluoride can be harmful to your health and especially to children." And it's very true. And so word-of-mouth advertising is great, and just come give us a chance. I think you'll see that we've got a fantastic team, and we'll help you get better.